My name is Kathleen Goss, and I'm from the University of Chicago Medicine Comprehensive Cancer Center. And I'm going to talk about research. So let's get started. I'm going to first share my screen so that you can see some slides that I've prepared. Okay, so as we know, cancer rates are going to increase significantly in the US and globally because of our aging population. And so these are data from the American Association for Cancer Research Cancer Progress Report. This is from 2018. But you can see there's going to be a significant increase in cancer cases and cancer deaths in the US in the next couple of decades. And so what that means is that we have to be very thoughtful and aggressive in impacting those cases and the incidence and cancer deaths through cancer research. And really this has to be tackling every phase of the cancer care continuum, everything from risk assessment to prevention, early detection and cancer diagnosis, treatment, and survivorship. And so if we look underneath here on this continuum, you can see various research areas or interests that investigators across the country and across the globe are really trying to tackle so that we can make a significant impact. And so underneath risk assessment, for example, understanding those genetic and lifestyle, environmental, and socioeconomic factors that contribute to an individual's risk for developing cancer. Developing strategies to prevent cancer through screening, vaccination, addressing modifiable risk factors. To improve early detection and diagnosis of cancer through novel and innovative imaging approaches, developing biomarkers that are predictive and sensitive, and then, trying to understand better how we can predict prognosis more accurately. In terms of treatment, and certainly we've come a long way in a lot of these areas, but especially emphasis on new targeted therapies, immunotherapy, nanotherapy, therapy resistance, understanding and how to overcome that, and biomarkers to monitor treatment effectiveness. And then in survivorship, how do we improve patient outcomes, maintain quality of life for cancer survivors, address the risk of second malignancies in those who have undergone treatment, and then deal with the very devastating consequences of financial toxicity for cancer survivors, as well as improving value of care. So these are areas that we that are really focused on in the entire cancer research community. But what I'd like to do is spend the next couple of minutes giving you some examples of each of these areas. And some of these examples come from some of our investigators at the University of Chicago. So this first example is one of our U Chicago physician scientists, Dr. Fumiola Patti. She's a breast cancer physician, but also a geneticist, and who really specializes in identifying identifying those genetic factors that contribute to the high risk of breast cancer and in certain types of breast cancer in some populations. And so not all cancers are caused by inherited mutations, but there are some that are, and you can see they vary. The percentage of those cancers with inherited mutations vary from tumor type to tumor type. But you can see in breast cancer, for example, that about 9 or 10% of all breast cancers are associated with inherited mutations, so mutations that are passed on from parent to child. And Dr. Lopati and her colleagues have worked really hard to understand how those mutations that are passed on um, lead to the development of breast cancer, and specifically the development of very aggressive breast cancer in women of African descent. And so she's focused on African American women in Chicago, especially on the South Side, but also in women from Western Africa. And so this work is incredibly important to help us learn how to assess risk and to reduce it using interventions. Prevention is really a very important and growing area in cancer research. Here, the example that I'm providing you is around the HPV vaccine, which has really proven to be a very effective cancer prevention tool. And so there's been robust cancer research that has gone in to developing that tool. And you can just see the time that it has taken to understand that the human papillomavirus is associated with certain cancers, like cervical cancer, to develop vaccines and then put those vaccines to use. And so what we can see here is that the vaccine has become a very important and valuable tool to preventing cancer, those cancers that are most highly associated with HPV infection. And so we know that if we vaccinated as much as we can, that the cancer cases would drop dramatically. And certainly work is going on to improve vaccination rates in populations, but also to make the vaccine more accessible globally. Certainly in some underserved communities and under-resourced countries, the availability of that vaccine is very limited, despite the fact that it has such potential for preventing cancer. In the area of early diagnosis or early detection and diagnosis of cancer, there are a lot of scientists like our own Dr. Mary Ellen Geiger at the University of Chicago, who has really devoted their career to developing strategies through imaging to diagnose and detect cancer earlier and more effectively. And so here's an example of a breast cancer or a breast mammogram, in which you can see the tumor in pink there in this 3D image. But the technology that Dr. Geiger and her colleagues have developed have allowed for computer-aided diagnosis to be a really important tool for radiologists to differentiate between tumors that may be benign and not very dangerous to the patient in the long term, from tumors that are certainly more aggressive and need to be treated as such. And Dr. Geiger and her work have been recognized recently. So her invention, her software called QuantX, through her company that she has founded, that helps with computer-aided diagnosis of breast cancer, has been named as a Time Best Invention last year. And so her work is incredibly important to aid our physicians in making the best clinical decisions that they can, when a patient is first diagnosed. In terms of treatment, I'm sure that many of you have heard that you've heard about personalized medicine. And this is really the concept of understanding that an individual's tumor and an individual patient is different from others, and we can exploit that by targeting their cancer with approaches that are more specific, and at the same time reduce the side effects of broader treatments that affect normal cells as well as cancer cells. So, for example, chemotherapy kills all cells that are rapidly growing in someone's body, and which is why you get all the side effects associated with that. Whereas if we targeted a specific mutation in a person's individual lung tumor, like shown here, say a particular genetic mutation, then that that treatment approach should be very effective against the cancer, but really leave the normal cells pretty much alone. And we think that this is really overall a very powerful way to approach treating cancer. There are several different flavors. I should just go back one second. Flavors of targeted or precision medicine or precision oncology. And you can see either exploiting the genetics of the cancer, using immunotherapy, where we're mobilizing a person's immune system, or targeted therapies, where it's really helping us turn drugs, using drugs to turn specific genes on or off. But in concept, it's really about personalizing the treatment approach. And one important component of all this is to understand at a molecular level how cancers work. And so that only comes through basic cancer research. And so this slide just gives you an illustration of the various features of cancers that we have come to understand through basic scientific research, and how our view of these alterations in cancer have changed even in a decade's time. You can see there are many more events or processes that we understand looking at this picture compared to this picture. But importantly, you can see on the outside of this figure that we've developed approaches to interrupt or disrupt some of those processes. So these are really our best guesses about how to cripple cancer cells and prevent the spread and development of cancer in patients and use them for treatments. Immunotherapy has been incredibly transformative in recent years. And again, this might be something you've heard about. Cancer immunotherapy can take a few different forms, either cellular therapy, where you can take immune cells from a patient and engineer them to make them essentially supercharged, put them back into a patient so that they can attack the cancer cells, or using antibodies to disrupt some of those pathways or networks that I illustrated on the previous slide. Or we use approaches that are called checkpoint inhibitors or immunomodulators, which are really almost like thermostats that turn up or turn down the immune system to help fight cancer. And this has really been an incredibly growing field in recent years. Work from Dr. Tom Gajewski at the University of Chicago and others has really been focused then on how do we optimize these immunotherapy strategies. So how do we improve responses and make them long lasting? So it turns out that some cancers don't respond very well to immunotherapy. You can see the variety of responses here to immunotherapy among different kinds of cancer. And then there are other cancers or patients, I should say, who show some response to an immunotherapy, but then their tumor becomes resistant to that. So why is that? How do we understand that? How do we develop tools to predict responsiveness? How do we account for other factors that might impact um, the the uh, the ability of immunotherapy to work? How do we take immunotherapy and combine it with other approaches to improve effectiveness? And how do we extend some of our successes in some cancer types to others and really broaden the impact? So that's some of the work that's going on now. And then in terms of survivorship, it's really important that we focus on um, improving quality of life for cancer survivors. So not just improving the length of someone's life, but also the quality. And so here's an example from Dr. Tara Henderson at our institution. Again, and she has led efforts using the childhood cancer survivor study with a lot of other investigators across the country to understand what the risks are for second cancers in children who have been diagnosed with cancer and treated for cancer. And so here's an example of some of the work that she's contributed to in the last few years, understanding, in this case, breast cancer after chest radiation therapy for childhood cancer survivors. And this work is incredibly important because it can really help guide how physicians monitor children who have faced cancer and make sure that we mitigate their risk of developing second cancers. So the timing of this presentation is really appropriate because May is National Cancer Research Month, in case you didn't know it. And so it's just, what I tried to do today was just to give you a sense of of how the cancer research community is trying to address every step along the cancer care continuum, from identifying factors that contribute to cancer risk and developing ways to reduce that risk, to try to identify strategies to prevent cancer, especially in high-risk populations, to develop approaches to better detect cancer, especially early, so that we have more tools to get better outcomes for those patients, to develop, obviously, new treatment strategies, and to improve overall outcomes for those patients. And then lastly, to improve survivorship and quality of life for cancer patients. So I will stop there and just thank you for your attention. Thanks for joining me today. I encourage you to rise up and make a difference with us in the lives of those who have been touched by cancer. And we really appreciate your partnership and you making a contribution today. So thanks again.